your periods so heavy that you have to change your pad every couple of hours? Do you plan your day around your periods? Or do you avoid social events because you might bleed through your clothes? Many women think that this is normal, but heavy periods is not at all normal, and you should not be simply putting up with it. Hello friends, my name is Dr. Jaya, and today I'm going to talk about a very common problem faced by many women worldwide, which is heavy menstrual bleeding or heavy periods. So first of all, let's try to talk what exactly is heavy periods. So this is quite subjective, and what might be heavy bleeding for one woman might not seem like a heavy bleeding for another. But clinically, or as per research, it is said that period blood which is more than 80 ml or which lasts for longer than 7 days is called heavy menstrual bleeding. But how do we measure 80 ml of blood, which is not really possible? So commonly what we describe heavy periods is when a woman says that the period is affecting her day-to-day activities, the period which is lasting longer than 7 days, or if she's bleeding through the pads every 1 to 2 hours, or if she's passing big clots which are about 2 centimeter size. So this is something which is called as heavy period. Why does it matter? Because heavy periods are not just inconvenient, but over time this heavy bleeding could lead to iron deficiency anemia, which can in turn cause symptoms like fatigue, tiredness, dizziness, chest pain and other symptoms. And as we discussed previously, some causes of heavy periods could be cancer or precancerous. So it is very important that any heavy bleeding is discussed with the doctor and the cause identified and treated. Now let's talk about causes of heavy periods. We could broadly divide under 3 headings. One would be uterine causes, like conditions such as fibroids or polyps, which are benign or non-cancerous conditions inside the uterus. Some cancerous or precancerous lesions could also be causing heavy periods. Sometimes endometriosis or adenomyosis could be the cause of heavy periods as well. Next, we can think about systemic causes like some coagulation disorders or bleeding disorders. Sometimes hypothyroidism or underactive thyroid could also cause heavy periods. And the third point could be under medications. Some medications like anticoagulants or antiplatelet drugs could also be causing heavy periods. How is heavy periods diagnosed then? Most of the times it's from the clinical history alone. Sometimes additional investigations might be needed to investigate an underlying cause, like a full blood count might be needed to check for underlying anemia, or a thyroid function test to rule out underactive thyroid. Sometimes an ultrasound scan might be needed to check for any uterine abnormalities which could be causing the heavy periods. Occasionally endometrial biopsy might also be needed. Now the next important point, how do we treat heavy periods? It is not a one-size-fits-all for every woman. It will depend on the cause identified and patient preference. But broadly, we can classify it into 2 headings. One is a non-hormonal treatment and hormonal treatment. In the non-hormonal treatment comes use of medications such as non-steroidal anti-inflammatory drugs like mefenamic acid, ibuprofen or naproxen, and an antifibrinolytic drug like tranexamic acid. They can provide effective control of heavy periods. The other option would be hormonal treatment like use of combined oral contraceptive pills or cyclical progesterone only pills, and sometimes use of a hormonal coil could also help with the heavy periods. And as I said before, it all depends on the cause identified. For example, if a fibroid or a polyp is identified, sometimes it might need surgical removal. Also, depending on how the symptoms are, sometimes another surgical procedure like endometrial ablation might also be required to manage heavy periods. To conclude, heavy periods are common, but common does not mean normal. If your periods are affecting your physical health or your quality of life, you should get properly assessed, you should see your doctor, and you should never ignore them, and you deserve to feel better. Thank you.